So we're now going into the second half of today, where Sue and Louise will be going into more detail about the revised changes that we've done to the Culture Leadership Program, and some other team members will be sharing what it takes to implement the Culture and Leadership Program and voices from various change teams. I'll then hand over to Sue and Louise.
Okay, thank you, Ronki. Thank you very much. Welcome back, everybody. My name is Sue Burgin. I'm one of the transformation leads here in the team, and I've been working in and around this programme for about 6 years. Louise?
Good afternoon, everyone. I'm Louise Pramas. I'm also a transformation lead in the Culture Transformation team, and I joined last summer, having worked in the Improving Health and Wellbeing programme and led that for a couple of years. Not an unrelated subject, very much overlap. We'll kind of cover some of the connections to this piece of work later on in our discussion this afternoon, but it's lovely to have you with us.
Okay, can we have the next slide, Shana? So I'm just going to take us through some changes, some of the initial changes to the Culture and Leadership Programme, which some of you know, and some of you might be coming to this for the first time. As Katie mentioned earlier, we commissioned an evaluation, an independent evaluation, which reported back to us just as we were heading, I think, into the first wave of the pandemic. And since then, we've reviewed the findings, and the key findings appear on the left of your screen. Katie's already mentioned a couple of things in terms of the scoping phase, the increased importance of equality, diversity and inclusion. And what's been happening in the period post the first wave of the pandemic, when our team started coming back together and working on this piece, are various updates to the published guidance, and some of you will be familiar with that. We've updated that to better reflect that scoping takes time, that actually you do need to prepare the ground, engage key people and spend time really planning rather than just attempting to run some diagnostics very, very quickly. Laying the groundwork really is hugely beneficial to organisations. And then I think one of the other major important elements is the development of the sixth cultural element on equity and inclusion. I think both the evaluation and the experience of the team to date had highlighted that although equality, diversity and inclusion had been embedded within the support and compassion cultural element previously, it was easy for organisations to miss it. So the evaluation, and then I think quite honestly our experiences of working through the pandemic and the disproportionate impact that had on some parts of our communities and some big sections of our workforce, meant that we really were serious about reviewing our focus on equality, diversity and inclusion. And that is reflected in the tools, guidance and templates that we have or will be publishing shortly on the website that Louise is going to be telling you about in just a second. So a lot of our guidance has been updated, but also what the evaluation and the experience of the team to date has taught us is that how we work as a team really can have an influence on how helping organisations engage with this work. So next slide, please, Shana. And the next slide is really just to reiterate that for us as a relatively small team, as of yesterday, we were +1. Ruth Evans has joined us from Royal Cornwall, so we didn't manage to get her picture up here just yet. But as a team, as we responded to the feedback from the evaluation and the plans we put in place to address that, every member of the team has played a role in terms of taking responsibility for significant chunks of the work and seeing this through to fruition. And I want to emphasise that because actually how we do our work as a team really matters, in that we want to really genuinely model the collective leadership approach. So no matter what somebody's role is within the team, everybody has played a role in terms of taking this work forward in various important ways. And if we move on to the next slide, Shana. this is our exciting new graphic, drum roll. So for those of you who are previously familiar with the work, as I've mentioned, there were 5 cultural elements. We now have 6. Equality and diversity actually appears as our 5th cultural element now. It isn't just tagged on at the end. And in terms of the new design of the programme, the sort of look of it going forward, what we've really tried to do is to marry that with what the people promise actually looks like visually, so there is some sort of read across there. And then moving on to the next slide, this is where we see the 6 cultural elements broken down, and there's a lot going on here in this slide. This is the conceptual framework, and this underpins the entire culture and leadership programme. The tools that Louise is going to be talking about in just a few moments are all underpinned by the cultural elements that you can see on the left there, and they're now expressed as being in support of performance and also people, because both of those orientations matter. As part of this work, we have a series of leadership behaviours that align to those cultural elements. And just to say that shortly, the Leadership and Lifelong Learning team from NHS England will be able to publish the Leadership Way, which was previously known as the Leadership Compact. And again, what we've done is mapped those leadership behaviours to what's happening with the Leadership Way. And of course, all of this links to outcomes that relate to quality and value, performance, motivation, improvement. And then the other thing to mention on this this slide, which really is the foundation of the programme, is that this work runs at various different levels. It is about how those cultural elements and behaviours play out at individual, team, the leadership level within organisations, the organisations themselves, and then across systems. So this model works in a variety of settings, and for those of you who've said, oh, this work in my context, we'd be delighted to have a conversation with you about that. I'm now going to hand over to Louise, I believe, who's going to say a little bit more about this work.
Thanks, Sue. And if I could have the next slide, please, Shana. So thank you. So the experience of the team working on the programme, and certainly highlighted in the independent evaluation we had, was, as Sue said earlier, that preparation for this work is vitally important, and particularly engaging a broad and diverse group of colleagues with the involvement and support of the board, and getting that at an early stage is absolutely crucial. So we've therefore formalised the scoping phase so that real focus and attention can be paid to that before you start moving into the discovery phase. Previously, elements of it were within the discovery phase, but this has now been formalised as the 4th and initial phase of the programme. So that provides you with a structure for what you need to do to consider to begin your journey, thinking deeply about the purpose of the work. Why are you wanting to undertake this in the first place at all? What are you aiming to achieve? And what is your vision for that work? So the scoping phase is also where you secure your board support and recruit to your change team. And it's really important that that change team really represents the organisation, so that it's diverse in every sense of the meaning. If you're on multiple sites, that those sites are represented. If it's multiple professions, you've got all those professions represented, as well as different ethnicities, different genders, really kind of take a really diverse diagonal slice through the organisation. We had a question in the chat earlier about crossover with the Civility and Respect programme, and I think it's important here to kind of touch on that, because we very much sort of see this as kind of a wraparound programme. When the culture is right for your organisation, and when that's in a good place and it's compassionate and it's inclusive, those other interventions such as civility and respect, health and wellbeing, retention, etc., can really start to gain ground, where previously they might not necessarily have achieved quite what you were necessarily hoping to. So, for example, in the discovery phase, you might draw in some of those diagnostics, like your workforce race equality standard, your workforce disability equality standard, health and wellbeing framework diagnostic, all those sorts of things that help you understand what is it like now. That's where you draw that into the discovery phase alongside the 6 tools that we've got as part of the programme, to really understand what your starting point is. Where are your dark spots? Where are your light spots? Where do you want to build on stuff that's already working well? And where do you need to make improvements? So, and then when you move then from the discovery phase into the design phase, you can really draw on expertise such as civility and respect, freedom to speak up, retention, or health and wellbeing, safety, draw all of those into the design phase, because that's really where you look at what you're going to do now that you know what you've got. What is the strategy you're going to implement? And then once you've got your strategy, you move into the design phase, and you'll notice that we've set this you move into the delivery phase, where you actually put that strategy into action. Once you've gone through the cycle once, we're actually now seeing organisations go through again and cycle round those 4 phases, because we know that culture work is never really done, it's never finished, because as you start making changes, the context changes. And it's also important to understand and check whether those changes you're making are having the desired impact. Are there any unintended consequences, positive or otherwise? And do you need to review the vision for the work? Does that still feel relevant to your organisation given that new context? Can I have the next slide, please, Shana? And as Sue said, we've got 6 tools or 6 discovery areas that we use. We've got a number of templates and resources to support you here. And we just wanted to kind of highlight some of the key changes that you might see for those of you who are familiar with the programme, and give you some assurance for those who aren't. So, for example, the culture and outcomes dashboard, we've actually added additional metrics so that we can really adequately give a snapshot of all 6 cultural elements. So equity and inclusion wasn't included as a separate element before. It was part of support and compassion, and we've drawn that out as a 6th cultural element. And just to reassure you, a lot of that data is data you already hold. It's just held in a number of different places. So this helps you to collect it in one place and understand your organisation. We're in the process of building that into Model Hospital as well. So hopefully in the not too distant future, you'll be able to go to Model Hospital and see your organisation's dashboard available to you there. Patient experience is a really important part of the programme, and understanding that. And so we've modified some of the questions and increased the emphasis on engaging with patients via existing internal mechanisms and the use of focus groups, which is similar to what we've done in the focus groups as well, making sure that questions have been revised to reflect equity and inclusion. But also we wanted to make sure that facilitation guidance was updated, because we want to make sure that change teams feel safe and capable of having those conversations, which can sometimes be a bit difficult, having conversations about how equitable is our organisation, how inclusive is it. So that's really, that's what we've done with that one. The leadership workforce analysis already sort of sufficiently covered a lot of the aspects, because it was looking at workforce planning and whether you have the board and the leadership skills capacity within the organisation to deliver on the vision. But actually what we've done is updated our user guidance to make sure that that tool can be used more effectively. Leadership behaviour survey has increased from 10 questions to 12, again making sure that support and compassion and equity and inclusion are both explored more fully. And we've also updated questions in the board interviews to reflect inclusion as well. We can have the next slide, please, Shana. So just to give you a bit of an overview, we now, in addition to these new resources and new materials, have a new national support programme, because we're really keen to make sure that we support you in a number of ways to help you to achieve the best of your ability in the organisation and really have a positive impact on your culture and make it a compassionate, inclusive workplace for everyone. So we've got a new learning network, and we'd love to for all of you to join us in that network. We've got our first learning event at which Professor Michael West has agreed to speak on the 14th of October. So please put your date in the diaries for that. More details will be coming out soon, and we'll be using our social media channels to get more information up about that in due course. But hot off the press, 14th of October, you've got a date. We're also wanting to create an online learning space together. So previously we would have come out to individual organisations and work with with change teams to develop skills and capacity to deliver on the programme, but recognising that actually there's something to the kind of flexibility of delivering online learning. We wanted to explore and develop a place for us to all learn together, and also be able to network and share information together. We also know that people want to talk and engage and interact. That's what we kind of hear all the time, and particularly we find that colleagues really value the connections that we can help them make across the country to learn from others. So that kind of human connection is a real sort of theme through this work. And then also, we're also on hand to provide support and advice. So do please make use of our NHSI Culture inbox. We've got the email address there, but it's nhsi.culture@nhs.net. And we're also on Twitter and Instagram with a growing network of colleagues on there as well. So we'll be posting news on those channels. And if you have the next slide, please, Dita. Oh, sorry, not Dita, Shana, sorry. So this has been my pride and joy for the last few months, building our new culture resource page, which has gone live this morning. I am absolutely thrilled to say that this is available there. It is growing and evolving and developing, but this really takes the resources as we had them. We've got some of the updated resources on there, and more will be coming. But also we wanted to really have a space that spoke to the ethos of our work. We want it to be a really human space. There will be more developments happening to this, but I would really love your feedback. I'd really love to know what you think. Does it work for you? If it doesn't, please let me know. If you really like something, please let me know too. And we want this to kind of become a place where we start to share your stories. So we're producing a range of resources to share learning. You know, those will be video case studies as well as written case studies. So if you've got a story to tell, again, we'd love to hear from you. And I think without further